Hello, welcome to my YouTube channel. Today we will talk about endometriosis and its clinical presentation. Endometriosis is defined as the presence of endometrial tissue outside the uterus. The most frequent sites of implantation are the pelvic viscera and the peritoneum. Today we will talk about diagnosis and clinic presentation. Endometriosis should be suspected in women with subfertility, dismenorrea, disparonia, or chronic pelvic pain, although these symptoms can be associated with other disease. Endometriosis may be asymptomatic even in women with more advanced disease, for example, ovarian endometriosis or deeply invasive rectovaginal endometriosis. Risk factors for endometriosis include short cycle length, heavier menstruation, and longer flow duration, probably related to a higher incidence of retrograde menstruation. Patient height and weight are positively and negatively associated with the risk of endometriosis. Endometriosis can be associated with significant gastrointestinal symptoms: pain, nausea, vomiting, bloating, and distension. Characteristic motility change is documented in most women with the disease. Women of reproductive age with endometriosis are not osteopenic. The average delay between onset of pain symptoms and surgically confirmed endometriosis is quite long, 8 years or longer in the United Kingdom and 9 to 12 years in the United States. A delay in diagnosis of endometriosis of 6 and 3 years in women with pain and women with infertility respectively was reported. Over the past 2 decades, there was a steady decrease in the delay in diagnosis and the decline in the prevalence of advanced endometriosis. At first diagnosis, patient awareness of endometriosis was increased. Many patients' quality of life is affected by pain, emotional impact of subfertility, anger about disease recurrence, and uncertainty about the future regarding repeated surgeries or long-term medical therapy and its side effects. Endometriosis should be perceived as a chronic disease, at least in a subset of highly symptomatic women, and quality of life issues should be evaluated using reliable and valid questionnaires. We talked about diagnosis of endometriosis and clinical presentation. Thanks for watching. See you in the next video.